talking about comprehensive sexual health education. So I appreciate your time, and I'm excited to hear your questions if you have any. And so let's get started. Let's get started. Here we go. Okay, sex, a broad term that can change with the following. As we develop and we grow and we have our life experiences, that can change sort of our understanding of sex, of our sexual being, whatever that may be. So what do you see, whether that's on a screen or in your life? What are you hearing? What sounds, whether that's from people that you know or don't know? Your kinesthetic. So how have you felt sex, sexuality? How have you been touched before, whether that's even a high five or not even physically been touched, but you actually can sense sort of a connection or some kind of physical experience from others or another person. Your spirituality. So what is your understanding of sex, sexuality, spiritually, and emotionally? Your desires play a big part of sex. And when I say desires, again, I want everyone to understand that I'm not just talking about people desiring sex or wanting sex. Some people in this world never want to engage in any kind of sexual activity, and that's perfectly fine. If they're comfortable with that and they're happy with that, that's great. Your knowledge and education, and this is where educators, we come in and we can, like Faye had said, we can empower our students. So with the more knowledge and education that they have, they're more likely to live successful lives because they can make those decisions for themselves to be happy and to stay healthy. Engagement. So how have you interacted with people, with the places around you, things that you either consciously or even unconsciously don't realize that you're actually engaging in. This all affects sort of our understanding of sex and our sexuality. And then also it's our values, our beliefs, and our comfort levels. So growing up, maybe your culture has, instilled their values and you've grown up that way and this is what you believe, and that's wonderful. As educators, we are not instilling our own values and beliefs on students. We are supporting their values and beliefs. We are just here to offer factual information and to inform them. So our first poll, Faye, I think we're gonna take a look now to see what grades do you teach. So I'm just curious to sort of see who has kind of come on the webinar today, if it's more primary based, intermediate, or secondary. So I'll just give you a moment to answer that question.
Yeah, if the poll doesn't work for you, you can also type your answers in the questions pane and we can see them. And it looks like 65% of you have responded, so we'll give another maybe 30 seconds for you to submit your responses. Okay, and in the questions pane, we have intermediate, grade 7, 8, 9. So some people are asking, what is intermediate? Is it?
Sorry,
grade?
Yeah, I guess we're thinking primary K to 3, intermediate about 4 to 7, and then 8 to 12 for secondary.
Okay.
Good question.
And then some people said all grades. Yeah, and Mitzi says, I am a school counselor and deal with all ages.
Wonderful.
All right. Okay, and I am gonna close the poll right now. And let me share the result with everyone. It looks like the majority of you responded to intermediate. So now I'll hand it back to Renee.
Great. Great. Thanks, Faye. Thank you, everyone. Okay, you in sexual health education, you need to understand what your foundation is first before you start educating others on sexual health education. Even though we're focused on the science of sexuality and sexual health education and factual based, it's still so important to understand where you are coming from. And it's okay if you're coming from a place of uncertainty, or maybe you didn't really enjoy your experience education wise growing up with sexual health education, but you need to understand, because sometimes when we talk about certain things, we don't even realize it. Our facial expressions, maybe our tone of voice, our body language will change, and we just need to be at a certain comfort level so that when we are talking about sexual health education to our students, or we're answering questions, we're not putting off any kind of vibe or expression or anything that's showing them that, you know, this is sort of could be a negative space, or not a sort of a safe space. So this, I just want to talk about a little bit for yourself here. What is something you wished you learned or knew about as a student? And to what extent did you receive sexual health education? So you don't need to respond. I just want you to think about this. When I say to what extent did you receive sexual health education, me personally, I remember in grade 10, I was walking along the street with my mom, and she said, you know, if you're gonna do that, then we'll go to the doctor and we'll get you the birth control pill. And that was pretty much, you know, my education from my parents. I did find a book where there was some sexual positions at someone's house, and I would look at it once in a while, and and then I'd kind of tuck it back away. And then some of you may remember or have had that experience. I think it was grade 9 biology, and it was science, and it was showing a woman giving birth, and the camera was right up to the vulva, the head is crowning, and this woman is just screaming. And so that was sort of, those are kind of my 3 areas of my sexual health education. And what is something you wished you learned or knew about as a student? So again, trying to put yourself in their position, them sitting in your counselor's office or in your classroom, and just try and think, you know, how did this feel when I was in school, and what were some questions that maybe at this age I would have had? And not that you have to express that to your students, but just sort of, again, kind of empathizing and reflecting back on that is really important as an educator. So some of you may have a piece of paper and a writing utensil with you, which is great. If not, don't worry about it. We're not going to ask anyone to post any information on the chat right now or chime in. But what I want you to do is you can either write it down, or if you want, you can close your eyes. And I'm going to say 3 different words. And when I say these words, I would appreciate if you kind of reflect and take notice of maybe other words that come to your mind, or pictures that come to your mind, or how you feel. So we're trying to sort of connect with what we're saying and to our reaction, basically. So right now, if you can, close your eyes. If you don't want to close your eyes, that's totally fine. Or if you want to write down or draw some things that come to your mind, you can do that as well. So the first word is sexuality. Sexuality. So just give you a moment. The second word is consent. Consent. And the third one is anal sex. Anal sex. So if your eyes are still closed, you can open them now. So again, just paying attention. I said 3 different words, And I want you to recognize how you felt when you heard those words, or even when you saw them on the screen. What came to mind? What pictures did you see, if any? And again, this is just sort of a reflection practice that will help you understand where you sit, your comfort level, and then how to move forward in order to support our learners. So Faye is going to put up our poll number 2. What do you find most difficult when teaching sexual health education? So are we looking for resources to support your curriculum? Maybe we're looking for knowledge on the content. Or are you concerned with possibly what parents or guardians are going to say, think, or do if they know that their children are receiving sexual health education at school? Thanks, Faye.
Yeah.
Okay, so what is your role and responsibility as an educator? If anyone ever has seen the movie Mean Girls, it says don't have sex because you will get pregnant and die. I believe at the end of this scene, he kind of hands out the condoms as well. So we want to stay away from this message. And let's take a look at what our roles and responsibilities are. So being professional, stick to the curriculum. Just take a look at your curriculum, try to figure out what resources connect with it. And at the end of this presentation, I'll offer some resources that I have, and I have tons more. So if we can connect by email or other ways too, if you need some specific resources. But being professional, you are the trusted adult, and we want to make sure that we are following the curriculum to support what we're doing and our students. Knowledgeable. You do not have to know it all. I don't know it all. But what the fabulous part about being educators and professionals is that we know how to be resourceful. So even if you don't know the information, at least you can have an understanding of, reliable resources that you can go to, or people, it doesn't have to be literature, and discover sort of the answers or extending the knowledge of your students, right? Thinking critically. So what are they really asking? And we'll get to anonymous questions in a little bit. But a lot of the times, we kind of jump to a conclusion of what the student wants to know, but sort of just take a step back, take a critical thought process on answering the question of what do they really want to know. And I can't tell you how often every question pretty much kind of ties to, am I normal? People just want to know, am I normal? I've had adults come up to me. I know some people on the call right now, they've heard this story, but I've had an adult come up to me one time and she said, Renee, my clitoris is really big. And I was like, okay. And I said, is it hurting you? And she said, no. And I said, is it causing you discomfort? And she said, no. And I said, okay. And I said, well, that's normal. And you could just see her whole shoulders just kind of move down. She was like, oh, I'm normal. But I said to her, I go, if you're concerned about it for whatever reason, I said, go speak to your physician, right? Because they're there to support us. Have an open mind. So be inclusive and respectful of all your learners. And I think that we do this all the time. So it's not necessarily obviously related to sexual health education. We're always trying to be inclusive with everybody. Everyone just wants to feel loved, cared for, safe, and that they have a sense of value. And then trustworthy. Once you start talking about sexual health education, you are now that askable adult. Again, you don't have to know all the information, but you probably are now going to be that person where students kind of knock on your door, or stay after class can ask questions. Or, I mean, I even had students I never even taught, and they would knock on my door and say, can I speak to you, Mrs. Gregerson? And they would start asking questions or need support. So just be ready for that. Setting the classroom environment, no put downs, words, watch your facial expressions, body language, and sounds. I can't tell you how successful our students and even adults are when they have proper communication skills. And so I like talking not only verbally, but what are your facial expressions? What's your body language like? What are you saying? What's your tone of voice? And I usually show my students the example of, you have 2 words. And so I could say to you, good job. And so my eyes are open, my hands are open, maybe I'm smiling, my tone of voice is nice and light, like, good job. That sounds good. This seems really good. Whereas if I say, good job, right? So now I'm kind of more closed off, my tone of voice has changed, my face doesn't look really impressed. So it's the same words, but obviously we're getting a different message. So if we can really start that process of how to actively listen to people's communication, we're well on our way. Respecting each other for who we are and that we're just here to learn. And like I said before, we just want to be cared for, loved, and feel safe. No personal questions. We want to try and stay away from students asking the educator personal questions about themselves. Obviously, there's certain areas where you can mention, well, I prefer this or that, or, I'm a person that doesn't like hugs or whatever, right? So that's safe, but just be aware, we want to try and stay away from personal stories. Also allowing our students to talk about maybe, like, I don't know, grandma or what's happening with their parents or whatever. We want to make sure that we're respecting everybody. With that being said, stories are wonderful, a wonderful way to connect the education with real life and actually to show reality to what we're talking about. So I actually do enjoy sharing some of my stories. Again, they're respectful, they are professional, but they are really tying in the curriculum. If I ever tell someone else's story, I always role model consent. So there's a story that I have of my friend. I won't say it today because we don't have enough time, but I say to the students, I'm going to tell you a story right now. And my friend said it was okay that I tell this story. Or I might say, you know what, I had a great story for you that really would help here. But I asked the person, they said, no, I'm not comfortable with you telling that story. And so I want to be respectful of that. And so I think that's really good role modeling that we can do for our students there. It's okay to pass. So maybe they put up their hand, all of a sudden they're like, nope, that's okay, don't force it. Questions are welcome, anonymous or not. Again, if you don't know how to answer the question right there when it's being asked, I have here put up a parking lot. So maybe on a sideboard or poster paper, you've got questions or topic areas the students want to discuss. Maybe it's not actually connected directly to the lesson that you're working on right then. And so that's a great way to kind of go back and say, okay, what questions do they have, or what other things do they want to discuss? And then also you can have anonymous questions asked as well. Use correct terms. If they are saying a term that isn't sort of scientific, so if they use the word dick instead of penis, you can just say, yes, the penis, and then just continue on. So you're just role modeling the proper terminology, and it's amazing how the students will pick up on that. I remember I had a grade 10 planning class, and they're having a quiz, and this one student puts up his hand, and he's like, okay, so Mrs. Gregerson, I know that the ejaculate comes out at the end of the penis approximately about 30 kilometers an hour, but I'm wondering about the semen. And he just kind of, it was beautiful. It was like, my heart was like, oh, I just couldn't, I don't know, it was wonderful. So he's using all the proper terminology. So again, when students know the proper terminology, when they understand their bodies, they are more likely to live a happy, healthy life and keep themselves safe. So let's keep that in mind. Listen when others are speaking. Again, practicing the active listening. This is what we do in a lot of our classes anyways. Respect personal boundaries, and we will be talking about boundaries in a little bit. We will be sensitive to diversity and be careful about making careless remarks. Again, I love telling my students, remember, we are all in this space together. We don't know what we're coming with into this space, and so we want to be sensitive to that and caring. And it's okay to have fun. Have fun. Sexual health education is great. We're talking about our bodies and how we live and how we, our needs and our wants and our desires. And, even that's if I desire ice cream or whatever that is. So you want to have fun with it. It's not supposed to be something that's super serious and like that. So, okay, so what is our goal for sexual health education? Understand the factors that contribute to healthy growth and development. We are talking about a human being. We walk around in these bodies all day long, and so many of us don't know what's going on, why it's doing that, or is this wrong, or is this right? Am I normal? So we are supporting that understanding of that human being. What a great opportunity. Making informed decisions and having strategies to solve problems. Hey, look, this is who you are. This is happening. What's a strategy here that you want to navigate through? Building healthy relationships by using effective communication and conflict resolution skills. Okay, if we can start young, these students are going to have better relationships, better career, life experiences. It's beautiful. Build self-awareness and a sense of identity. So who am I? That changes as we grow. I am definitely not the same person as I was when I was 20, and I probably won't be when I'm 60. So that understanding of, when you reach a certain age, maybe the end of puberty, that's not just who you are. You still have life experiences, knowledge and education coming at you. And so we're always developing and changing. So I think allowing that comfort to our students to kind of let them know that would really be beneficial. And then build skills to keep them safe from harm, so emotional, social, physical, etc. We want to keep these students safe. And I think that's a really wonderful message to even give to parents and guardians. I am trying to support your child's overall growth, development, and support their safety. And build critical thinking skills, right? And so if something comes at them, or knowledge, or a person or a situation, to think critically. How can I keep myself safe? Or do I like this? Or do I want this? Or do I want to continue, etc., right? So here's our poll number 3. Which area of sexual health education would you like support with? And I think Faye's going to throw that up for you. So I'm just always curious, what areas are people concerned about, or they would, maybe resources they're looking for, or knowledge and content.
And Renee, whenever you're ready to launch the second question, I have that question set up already. And in the question pane, some people said they're interested in all of those.
Fair enough.
Too bad I cannot select all.
I guess I should have put that option. All of it. I just want to know all of it.
And some people are asking about the French resource.
There are a couple French resources. Actually, that's a great question. And I can definitely connect with those people and offer the resources that I currently have. But I'm working with one of the French helping teachers with the Surrey School District. And so we're working together on sort of creating a little bit more resources regarding the French area. So thank you for that. That's good.
Awesome. It looks like 76% of you have responded. Those of you have not yet responded, go ahead and submit your responses, and we will close the poll in a few moments. Yeah, okay. Yeah, some people said, oh, but if I have to pick, then they picked sexuality. All right, so we're now closing the poll, and let me share the result with everyone.
Okay, so 7%.
Okay, and I'll hand it back over to Renee.
Great. Thank you, Faye. Thank you, everyone. Okay, so sexuality, puberty, those are the two big ones. Okay. Let's take a look. So what I decided for this webinar, because obviously kindergarten to grade 12, there's so much information, and obviously I can dive deeper into sort of all these areas. So I kept it kind of like, this is sort of the general basis of sexual health education. These are areas you can focus on within certain grades. And then I'm actually hoping to offer another webinar, or even a couple if possible, to kind of dive deeper into those areas, whether it's sexuality, puberty, etc., if people were interested. So we'll move on from there. So grades K to 3, I wrote, in BC, we write I can statements. So we want the students to be able to say, I can name the parts of the body, both typical female and typical male. If you notice, I put typical female, typical male. We never want to assume, but we also want them to understand the different body parts that you would see on a typical female body and a typical male body. Demonstrate and discuss appropriate and inappropriate ways of being touched. What a wonderful conversation, right? Because this will allow them, again, if maybe they are being inappropriately touched by somebody, maybe it's a neighbor or a peer or whatever, if they have the knowledge of their body and what is appropriate and what's not, and also given these skills to say, I'm not okay with this, or also know who they can go to talk to, then again, it's going to keep them safe, right? Describe reliable health information sources. So maybe that's a physician, a school counselor, maybe if you have a school nurse, a teacher, a parent or guardian. So just having them understand, where can I go if I need support or I have questions? Demonstrate and discuss practices that promote health and well-being. Again, if we teach proper nutrition, so you should have vegetables and fruits and this and that, whatever, then we should also teach them about their bodies and keeping that healthy as well, right? So proper cleaning practices, even something as putting sunscreen on your skin, or staying out of the sun in the shade, or whatever, right? So we're talking about the whole being again. When we talk about sexual health education, a lot of people always think, right to sex or sexual intercourse, but it's all encompassing, right? Apply strategies and skills to use in potentially hazardous, unsafe, abusive situations. If we teach children how to keep themselves safe if there's a fire in the home, and those strategies and skills, then we also have to teach them to keep their bodies safe as well, right? Identify my emotions and manage to express them in healthy ways. Sometimes they're getting really mad or frustrated, but they don't have the words, or they don't even understand why I'm feeling this way. So my son came in yesterday. He had recorded his lesson online, and it kept sort of just messing up, and he couldn't do it. So he had recorded himself about 3 times, and his face was straight and his tone of voice changed. And I said, you look frustrated. And so again, it's now he's connecting with how I'm feeling with a word, possibly, right? I threw that out there. Maybe he wasn't frustrated, but at least it was allowing him some education on connecting the emotion and how you can sort of label that or name that. Discuss the differences between a healthy relationship and an unhealthy relationship. Again, we have the opportunity to support our students in understanding what a healthy relationship is. And I'm not just talking about an intimate relationship. I'm talking about peer relationships, family relationships, relationships with educators, with physicians, with the community. It is so important to teach people for themselves what a healthy relationship is. And again, because we can't really necessarily say this is in this box, this is what a healthy relationship is, because we're all different. We want to respect that. But for themselves, the knowing for themselves. Grades 4 to 6, demonstrate. So again, we're not saying, okay, K to 3, that's done, we did it. It's all blended and continuously taught. So what we did in K to 3 will also be in 4 to 6. Also, we're going to add to that though. So demonstrating and understanding, applying proper hygienic procedures. So, certain parts of the body, just like, it's our armpits, as you start going through puberty, you might get some body odor. And so, some people really enjoy their body odor and some people choose to get rid of it. And I think it's really important to teach what are some ways if they want to get rid of the body odor. You can use, soap and warm water. You can use deodorant or antiperspirant, and understanding the difference between those two. So offering opportunities for the students to make those decisions for themselves, again, but keeping them healthy. Demonstrate and discuss strategies for responding to bullying, discrimination, and violence. Again, some people don't even see that as part of sexual education. But again, we're talking about the emotional well-being, the mental well-being, the physical well-being, the whole person. Describe and discuss puberty for all bodies. Usually when I would do this lesson, I would have on the board every body section, a typical female body section, and a typical male body section. So in the every body section, it would talk about sort of your growth spurts and why that happens, possibly your skin getting a bit oily and getting pimples. So kind of like all the changes. And then the typical female, I would go into a body with that has a uterus and talk about menstruation, and then with male bodies, nocturnal emissions, etc., etc. I think some people ask me, should you have a whole class of just typical females and then a whole class of just typical males on their own so that they're more likely to ask questions or feel comfortable? If you choose to do that, I think you should just make sure that you're also teaching every student about both bodies. Again, how great is it if, say, you have a typical female, typical male partnership, and the female, has her period, and the male goes, oh yeah, sure, I'll run out and, if that person chooses to use a tampon, I'll run out and grab you some tampons. It's probably a heavy flow right now, so do you need super or whatever, right? But yeah, so just the understanding and the comfort level there, I think, is really important in that education. Apply skills, so empathy, effective communication, active listening, boundaries, so understanding what are your boundaries. With students, I'll say, if you have a sleepover and your friend forgot their toothbrush, are you going to say, here, use mine? And a lot of them go like, ew. And I'm like, well, that's a boundary you've set for yourself, a material boundary. So understanding that they've already set certain boundaries for themselves, and it's very empowering when you can understand what you've set for yourself and what you want. Describe potential hazards and understand how to stay safe at the home, in the community, and online. Describe factors that support one's identity for healthy growth and living throughout life. Then I transfer into 7 to 9. As they're getting older, looking at healthy sexual decision making, I love saying to students, I am not educating on this because everyone in this room has had sex, will have sex, and wants to have sex. I am just giving you information, right? It's if I'm talking about, ice cream. Some people may not like ice cream. Some people may want ice cream when they're 20. Some people like trying a couple different flavors when they're 35, whatever. I'm just saying, here's some information, and now you can make a decision for yourself, right? Describe, demonstrate, and apply practices that reduce the risk of contracting STIs. I get a question a lot by students is, can you get a STI from a toilet seat? And so I say, well, if you would like to try and get an STI from a toilet seat, this is how you do it. And I say, someone, we'll say they have gonorrhea, will go into a bathroom, they will sit on the toilet seat, and they will rub their genitals all over the toilet seat. And then you are waiting outside the door for that person to get off the toilet seat, and you bust in there, and then you rub your genitals all over the toilet seat. Maybe then you can get gonorrhea. So again, it's their understanding of how things are contracted. So skins have to touch, fluids have to mix, etc. But how does that happen? I love the science of it. Locate and describe sources of health information. Is there a youth clinic nearby? A school counselor? Who is it that they can go to for support? Describe different types of healthy and unhealthy relationships. Again, we're building on these skills continuously. List and describe ways to protect against STI transmission. A lot of times I'll say, okay, name some contraceptives, and students will say birth control pill. I'm like, great. And then they'll say, condoms. I'm like, awesome. And then it's crickets. And it's amazing, there's so many types of contraceptives out there. So possibly if someone doesn't want to take the birth control pill, maybe it hasn't worked well with their body, whatever the reason, you can offer them other alternatives to using different types of contraceptives to keep themselves safe, whether that's protecting from STI transmission or from a possible pregnancy. Apply strategies to support my overall health and well-being. Describe and understand my own personal boundaries. Describe consent practices and strategies. So with consent, a lot of times we teach kids, like say the word no, and facial expression, the words no, body language again, which is great. But again, I also, when the older grades, I like to teach them sort of, not necessarily, I don't want to say reality, but sort of the way things go. Like if you have two people together and say they're 16 and they're sitting on the couch and someone says, can I put my arm around you? Yes, you can put your arm around me. Can I kiss you on the cheek? Yes, you can kiss me on the cheek. Can I put my tongue inside your mouth? No, you can't put your tongue inside my mouth. A lot of times we don't have those conversations, but this is why I said from the very beginning, taking a look at different ways we communicate. So I love talking to students about, say you were to put your arm around someone and they go like this. They're not saying no, but like they're really saying, I'm not okay with this. This is a no, right? So you're kind of like shifting away the facial expression, like it's just, so again, starting from the beginning, if they can understand how to communicate effectively, and even that person being able to be like comfortable with like, no, thank you, or I don't want that, or whatever, right? So again, keeping them safe. And then also, what is a yes? What does that look like? What does that sound like, right? Describe the reproductive system and stages of life, and identify intersecting factors that affect the development of a person's self-concept, including their sexual orientation. I left out grade 10 to 12. Some schools have grade 10, 12 sexual health education, some don't. Some have options to, or the option to opt out, and then it's kind of left up to the parent or guardian to teach the required curriculum and then show the principal of that school that they've met the curriculum requirement. So, but grade 10, again, very similar to STI transmission, still working on relationships, contraceptives, healthy practices. So for anonymous questions, I used to have a box with little question marks on top of it. And what I would do is I would tell the students, take out a piece of paper, try not to do scraps because you'll get these little itty bitty questions. So kind of maybe give them a card or have them on a regular size paper and just get them to either write down something they've learned, which is great feedback for yourself. So what did you learn today? Or what did you, didn't know or you're curious about later on? So it's another question too. So what would you like to know more about? Or is there a question that you have that you would like me to answer? And so at least everybody's writing, so it's not like, oh, look, Sally's writing over there. I wonder if this is her question, right? So everyone wrote something down. With anonymous questions, don't do it on the fly. I would suggest do not. You could try, go for it. But sometimes it's really important to think about, again, what is this student truly asking? So trying to figure out what is the behind question. Some of them will try and sort of mess you up. They want to see your face go red and maybe your voice quiver or whatever. But that's where I like the normalize and validate part of it. So when you're ready to answer, you pull it out. Again, it's anonymous. We don't know who it is. And you say, oh, this is a great question. And it's funny because when they try to mess you up and you're like, oh my gosh, everybody's asked me this, but it's such a good question. They kind of go, oh. But then it's a great opportunity to answer it as well. So normalize and validate it. How great is it if a student sits in class, they're super nervous about their question, they don't want anyone to know, or they're afraid of what the person, their peers or their teacher will think, and then all of a sudden the teacher's like, oh, good question, or this happens a lot, or whatever. Then they're like, ah, that's so comforting. Clarify. So be sure you understand what's being asked. Rephrase it. So if they are using sort of not the scientific terminology, so again, say they use the word, let's use what I used before. If they use the word dick, just sort of say penis instead, and so that we're role modeling and practicing that as well. Answer the questions honestly, so include facts. Just be neutral tone, expression, you're answering the question, and keep it simple. You don't need to extend and extend and extend and extend and extend. You don't need to tell them all of it, just answer the question. And then if you get an opportunity, hopefully you will, and they will, is you say, well, you know, I think I answered this question correctly, but if I didn't, if you need some more clarification, there'll be another opportunity to have anonymous questions. Here in BC, and I believe it's also connected to the Yukon, we have the 1-800-SEX Sense line. And so possibly in other provinces, hopefully you have something similar. So when teachers have anonymous questions or students have questions and the teacher either is uncomfortable answering the questions or doesn't feel as knowledgeable, you can call the Sex Sense line and you put it on speaker. A student can ask a question and there is a nurse or a sexual health educator ready to answer that question. So that's kind of fun and interactive. It also allows them to understand, you know, if I were to call this, well, how does this really work, right? And then it's completely anonymous. So again, just normalize and validate, clarify, answer the questions honestly, and check in. So I just wrote out a couple different grades on some kind of typical questions that I have had. So grade 1, I love this question, it's so cute. I can see the student just sitting there with their little hand up. And I like hugs. Are hugs good touching? And I think, what a great question, because a lot of us want to say, yes, hugs are great. You know, they even release serotonin and dopamine, and not that you would say that for grade 1, but some people, even adults, don't like hugs. So this is a great thing, again, talking about communication, right? So say that student really likes hugs, wants to hug their friend. It's a great thing to say, you know what, if you really want to hug your friend, you can say, I like hugs, can I hug you? And again, respecting the person's response. If that person says, no, thank you, then you respect that, right? Grade 5, I actually asked my son this one. I said, you know, in class, if your teacher was talking about sexual education, what do you think like you or your peers might ask? And he said, does anything bad happen during puberty? Again, great question from a student, because the word bad, like they're nervous. Like, is something gonna hurt? Is something gonna go wrong? Like, what is, I've heard this word puberty, what's happening? Apparently my whole body is changing. What am I gonna like morph into some kind of like monster? I don't know. So again, another great way to be like, oh, let's bring some clarity and some comfort to our students. Grade 7, how do you know someone likes you more than a friend? Actually, this was one I thought about. I'm like, grade 7, what did I think about in grade 7? And it was true. It was, I always wanted to know, like, you know, how do you know that person likes you more than a friend? And again, if we can teach our students body language, tone of voice, different types of actions that people might take to kind of show you that they're interested in you or they want to be your friend or, you know, boyfriend, girlfriend, whatever. Again, it just allows us to make those connections. In grade 10, I actually had this question a lot. My mom said the pill is bad because it causes blood clots. Is this true? So we kind of talk about the science of the pill. The pill is, I believe it's the most tested medication on the planet, which is very interesting to me. But I also say, you know, when you get pregnant, you are at a higher risk of getting blood clots. Well, you don't see people say, well, I'm not getting pregnant because I don't want any blood clots. So again, we want to respect the student, their decision. So we're offering information about the pill. And then we can say, but if you're not comfortable with that, there's other options for you, right? So, and our last poll that we have, Faye will put it up there. Which would you prefer if we offered another sexual health education webinar? So are we looking for resources? Would you like a demonstration of a lesson? Would you like kind of more of a educator content informational webinar?
All of you are saying all of them again.
Which is great. I love this. I could talk about sexual education all day. So I would love to offer more.
All right, so it looks like 75% of you have voted. We'll give another 10 seconds. And we've also received a lot of good questions, so we can address those in the Q&A session.
Perfect.
Okay, so we're now closing the poll, and let me share the result.
Okay, so resources, lesson demonstration. Okay, great. Thank you, everyone. So my final comments to everybody. We are teaching respect for diversity, for valuing everyone and everybody. We want the children to have the right to inclusive education, to sit in our space and their space and feel comfortable, confident, and supported. We are teaching sexual health education because it's mandated, it's a mandated curriculum. You are the professional, you are the trusted, askable adult. Again, we're kind of opening up doors, opening up windows, which is a great space. Again, if you're nervous or scared or concerned, that's perfectly normal and understandable. Again, we don't have to know it all, we just have to be resourceful. We are supporting our students' overall well-being, health, and safety, offering opportunities to make informed decisions with a comprehensive sexual health education curriculum, and students are learning safe and healthy practices in loving oneself, which offers the beauty of peace, kindness, and care towards oneself and others. I had a student the other day that I saw. He hasn't been my student for years, so he's kind of a grown man now. And he said, you know, Mrs. Gregerson, my friend was having, girl problems. And he goes, I remember our talks in Planning 10 and how to communicate. He goes, I'm really supporting him on proper, healthy communication practices. And I was like, oh my God, I love you. But okay, so resources. Everyone will receive a copy of this presentation. So I'm not going to go through the resources because now I'd like to get to the question and answers. But I kind of put a few for educators for K-3 level, grades 4 to 7, and secondary level as well. Again, I have tons more. I just thought I would throw up some here for you. And Faye said there was questions, so you can either answer these questions here. So what's one thing you've learned and will put into practice after this webinar? What sexual health education resources have you been using currently that have been beneficial when educating your students? Or I would love to hear your questions.
All right, so thank you, Renee. And we're now going to begin answering some of the questions submitted during today's presentation. We've received many good questions, and we'll try to answer a couple of them. And the first question, but as a reminder, you can still submit questions throughout the questions pane in your attendee control panel. And so let's dig into them. The first question is from Eve, and the question is regarding gender inclusion in sexual health. So is it gender inclusive to use the word male and female? So how careful we need to be?
When you're addressing the class, we're trying to stay away from, okay, boys and girls, or, quiet down, boys and girls. Again, that's not really inclusive. So you could say, folks, I used to always call my students friends, like, good morning, friends. I think that really creates a good connection with your students. Again, we want to maintain that professionalism, but we also want to be human. And again, sexual education can be a touchy topic. So with calling them friends or folks or everyone or everybody, that's sort of a nice way to be inclusive that way. Like I said before, if we're talking about sort of physiology and anatomy, we're not saying, well, this is the female and this is the male. We're saying this is the typical female, this is the typical male. But if you don't feel like you kind of fit in these categories, that's okay. We're just talking about these bodies to understand the biology of what you're living in or what someone is living in. So just that, I hope I answered that clearly. If I didn't, I can clarify a bit more.
Okay, so if Eve is asking for more explanation, you can text your follow-up question in the question pane, but we'll go to the next question. And this question is, how do you deal with a student who is disturbing the class because he or she feels uncomfortable and isn't sure how to deal with these emotions?
Oh, great question. That happens all the time. So yeah, so they're uncomfortable, and so sometimes they act out. They may make noises, they may try and ask silly questions, maybe they're tapping their pencil. It's important as an educator to understand that. We're not trying to force, again, it's supposed to be a safe, comfortable space. So again, when you set the tone of the classroom in the very beginning, whether that's the beginning of the year or even when you're starting sexual education, I hope that you've started the beginning of the year, not just in the sexual education aspect of it. Just talking, just say, you know what, we are all coming from different places. We all have values and beliefs, and we are respecting everybody's values and beliefs. Some people are more confident in certain areas. And again, not just talking about sexual education, but just in life. Some people are confident in this activity or in this space or knowing this information, and some aren't, and that's okay. And then again, if a student is kind of being really distracting, I think it's really important to take a moment. So maybe there's a time when the students are doing an activity and just kind of go over to that student and just kind of recognize it. Just say, you know, I noticed that you were moving a lot during our lesson today, or I noticed that, you know, you were kind of acting out or kind of bugging your peers when we were talking about this. You know, is everything okay? You know, are you feeling a little uncomfortable? Again, kind of trying to connect their behavior and what they're feeling with words, and also that you're recognizing it, but it's a comfortable, recognized space for them. And say, you know, what can we do to support you on this, right? And some students might get a little like, oh, you know, they noticed or whatever. But that's fine. Again, it's just sort of you're offering that space of comfort, and that, you know, it's just knowledge, just education, and we want to respect everybody and just care for them. Just say, you know what, this can be uncomfortable, and you're not the only one that feels that way. Even when I was a student, I was sitting there, and sometimes some topics came up and I felt a little uncomfortable myself. So maybe what are some things that we can do to support you on that? Maybe you get them a little quiet stress ball that they kind of squeeze quietly so it's not disrupting the class. Maybe you offer them the opportunity, depending on the age, and if maybe you have support in the classroom, an opportunity to kind of remove themselves for a couple moments from the classroom and then come back in. Maybe you offer them the opportunity to quietly read a book while you're doing a lesson. I know there's lots of students I had one student that she would just read, but she heard everything I was talking about. Because if I asked a question, she'd put up her hand, she'd know the answer, but she just felt comfortable kind of reading her book or kind of looking down at a book, maybe drawing. So some kind of like doodling while you're talking. It kind of just releases a little bit of that nervous behavior. So I hope that helps a little bit. Thank you for that question.
Perfect. Next question is from Jelko, and the question is, now, as you know, parents may exempt their children from sex education classes. So what is the alternative?
Again, good question. I mean, I know in BC right now, we have a sexual health education policy, and every student has the right to this education. And again, for reasons we've talked about for the past 45 minutes. So we know it's important. The student may not understand if it's important or not, but the parents or guardians are concerned about it. So with what we do in BC anyways, is we say, okay, if you are uncomfortable having your child in these lessons on sexual education, then this is the required curriculum, and you are welcome to take it home and complete the required curriculum with you and your child. And then they are supposed to go to the principal of the school and say, this is how we've met the required curriculum. So they just have to demonstrate that they've done that. Again, no one can tie a kid down or a parent and say, no, you're getting this, as much as we would like them to have it. So I'm not sure what your policy is in your province, but it would be definitely beneficial to have that conversation with your principal and take a look at what your district or province has set out for you.
Okay, lovely. And the next question is asked by more than one educator, and it's more closely related to the current education situation. So the question is, what is your opinion on sending home health lessons for sexual education during this time of homeschooling? Or do you have any suggestions for teaching this material online?
Okay, good. Well, actually, Physical and Health Education Canada, PHE Canada, actually just put out some healthy bodies lessons on their website. I love them. I think they're super cute. They're wonderful. Again, I wouldn't suggest, I know that I believe that some educators have put out lessons in this remote learning. Basically, maybe it's a research and an STI. Well, we want to be cautious and careful with something like that because we don't want students just to go on Google, type in STIs, because it's amazing what's out there and what they'll see. And we want to make sure that they are getting accurate information that's going to keep them healthy and safe. So again, like I said, sexual health education is all encompassing. So looking at the whole body, the person, getting them to reflect on themselves, maybe talking about relationships, I think is a great question. Getting them to have conversations with their parents or guardians, and maybe it's a interview process, and you talk about like what is a healthy relationship. Getting them to open up that conversation with their parents or guardians or close family members, like how do you know? What does someone look like when they like you? Or and again, when I say like you, doesn't necessarily mean like intimately, but even as a friend. So I think I would stick to like healthy relationships, looking at students' boundaries, consent, getting them to reflect on their whole being. So what do I think about that? How do I feel about that? It can be tricky. We don't, again, like I said, we don't really want students to start Googling, sexual intercourse or nocturnal emissions or anything like that. So I would kind of stay clear of those kind of specifics anyways.
Perfect. And the next question is from Sean. How do you discuss and teach sexuality and gender identity without having an unintentional or accidental influence on the student choice of these?
Okay, so what I think this person's asking is, how do I educate them on sexuality without, I guess, changing or like that person said, influencing how the student behaves or understands himself? I think that's sort of what's the question. I think again, it's the idea of that student will know themselves. That student, we're presented with information and education all the time. And, we do have an influence on our students, right? And that's why I said, understanding yourself, where you're coming from, your body language, tone of voice, etc. Keeping that professional behavior, educating to the curriculum. You're offering understanding and respect. And so I think that I'm never afraid, and I wouldn't want you to be afraid that if you start talking about, being a lesbian or lesbians or whatever, that now we're, changing the minds of everybody. And, a certain student might be like, oh man, I think I'm a lesbian, which is okay for them to be like, okay, like, maybe it's an understanding, right? I felt that way. So what does that mean? Does that mean I'm a lesbian? Again, offering that opportunity through your lesson to be like, some people, they felt that way, but then they change their mind and they don't. Some people, are starting to feel this way and they're like, oh, maybe I think I'd like to stay away from labels. I like to tell my students, try to stay away from labels. Don't label yourself. I don't like people putting themselves in a box. This is what you are. Because, like I said, we're always changing. Even I've changed since I was 20. So we are giving labels for the understanding, but don't try and teach to the student, don't put yourself in a box and label yourself, because we're always developing. So I think if you can offer that opportunity, that understanding of we're always changing, we're always, understanding ourselves in hopefully a better, healthier way, then they'll have a sense of like, okay, so it's not that I'm this, but it could be, and maybe we can explore that, or that's safe or healthy to explore that. Hope I answered that correctly.
Okay, and we'll give some time to another 2 questions, and then we'll finish this session. So the next question is from Sabine, and the question is, our curriculum is so old, and I'm a bit concerned that we're out of touch with today's world. So do you have any suggestions for her?
I'm curious, like, what areas of the curriculum this person is talking about for being old, or excuse me, outdated.
I'm not sure if she's still online with us, because I know a lot of people have other plans at 1 p.m. ET. So what if, like, let's just maybe rephrase the question saying, what if the educator find the curriculum needs to be updated, and do they still follow the curriculum, or do they have a lot of flexibility in terms of choose what to teach?
Well, professionally, we are supposed to follow the curriculum that has been laid out for our students and for our education system. With that being said, I understand that there probably are areas that are outdated, which obviously is a concern, again, because we want to support the health of the students. I think I would definitely have that conversation with your administration, saying, you know what, I'm understanding this is the curriculum, but I'm also understanding, these areas are a little outdated, and we need to make sure that we are supporting the health and well-being of our students. Can we look at opportunities to offer resources or areas to kind of fit in a little bit more of a broader understanding of sexual health education, and start that conversation with your admin and start making the connections to support the areas that you want to expand on.
Okay. Thank you, Renee. And the last question is from Scotty, and the question is, how do you handle how-to questions and the influence of porn in youth and younger age students?
Sorry, how-to questions?
Yeah, how-to questions. I'm thinking maybe he's referring to the anonymous questions.
Okay, sorry, Faye, can you repeat the question again?
So Scott is asking, how do you handle how-to questions and the influence of porn in younger age students?
Okay, so the influence of porn, is that what you said?
Or Scotty said that means how to have sex.
Oh.
And then, yeah.
Yeah. Oh, Scotty, love you. Great question. Okay, so this is actually, I had an hour-long conversation once with an educator. She called me up and she said, Renee, she goes, my student asked me, how do 2 girls have sex? And she's like, so what do I start saying? Do I start talking about like scissoring, like what? And I said, whoa, relax. So again, think about, what is this student asking? A lot of times when we think about sexual intercourse, we're always constantly kind of going to that PV sex, so penis and vagina sex. So a lot of times students are going like, okay, there's no penis involved, I don't get it. How do they do that, right? But I love answering the question by saying, I don't know how anybody has sex. Because we're all different, and that's where the communication with that partner comes in. I can't say that, this is how you have sex, because I don't know, maybe some people, like this position and other people don't. Maybe some people go this far and other people don't. So when it's the how do people have sex, you need kind of more clarification from the student on basically, what are you asking? Are you talking about sort of, how do 2 people get to the process of actual sexual intercourse? Are you talking about, how does, maybe if we're talking about PV sex, how does the penis actually, get or fit in the vagina? So again, talking about a little bit of the anatomy part, which I love talking about that with my students. So again, the understanding of the body, and the body is just amazing. So yeah, so it just, again, you need some more clarification on what the student is asking, but I love the opportunity to say to them, we all are different and we have to respect ourselves and have that great communication with the person we're choosing to engage with, to understand what is going to be the healthiest for us, and understanding what we enjoy and what we don't enjoy, maybe what we're not okay with, but we're, still kind of would like to discuss a little bit more on that. So I love that question. Good job, Scotty.
And Scotty said thank you, and is gonna use that answer. So that's great. And I think that's a wrap. So Renee, is there anything else you want to add?
I just want to say, for the people that took the time today to listen, I don't even know what I sound like, but anyways, you got that phone voice. I hate my phone voice. For those of you that came and listened today, I hope that you can take something away from this webinar. Even if it's more of a general understanding, I want you to relax a bit more with sexual health education, offer that comfort for your students. And again, we all as human beings just want to feel safe, have comfort. We want to feel loved, and that we have a sense of value. And that's what we are offering. And if we can do that for our students, they are going to be more successful in their relationships, their careers, their daily lives. And what a wonderful opportunity that we have. So thank you very much. I'm hoping to offer more webinars, and I hope everyone has a wonderful day.
Awesome. And Renee, can you include your email in the PowerPoint? So I think here some attendees want to contact you individually after. So is that okay with you?
Yep, of course. It's in the PowerPoint already.
Perfect.
Yeah, thank you.
Perfect. And thank you, Renee, again. And thank you, everyone, for attending today's webinar. And if you have any other questions that we're unable to reach to, please contact me at conference@phcanada.ca or contact Renee directly. Once you leave today's webinar, you will receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar, the PowerPoint, and also some of the resources that we talk about. On behalf of PHE Canada, our presenters and partners, Human Kinetics and Canada's National Ballet School, thank you for joining us today and have a great rest of your day. Thank you, Renee. Bye, everyone. Bye.